right? So we are here as people who've had cancer. My name is Candid Diana. I'm Diana Ward Chest, and I'm going to allow my sister to introduce herself.
Hello, everyone. My name is Fatou. I'm from the Gambia, West Africa, but right now I'm living in the US. I'm a cancer driver, breast cancer and cervical cancer.
We are going to go through Fatou's journey, but we are going to focus more on cervical cancer this month. And there's something we also want her to talk to us about the HPV vaccine and HPV, and what, as a cervical cancer driver, what she thinks about all that. All right. So again, welcome. Now, Fatou, you are from the Gambia, and we've interacted with you in the past. We know that you had breast cancer also, and you were treated for breast cancer. Now, would you share with us, did cervical cancer come after breast cancer, or did breast cancer come after cervical cancer?
No, the cervical cancer came after the breast cancer.
Okay. Okay.
Yeah.
And how did they find the cervical cancer?
And that was even a surprise to them, because as like here, they tell you if you are not at this certain age, you cannot do mammogram, or you cannot do, the how do they call the test, the swab.
Yeah.
So that was my first time to do the swab,
Pap smear?
the pap smear.
Yes.
So that was the first time to do it, just to make sure, I'm going through all this treatment. So they just wanted to see everything is okay. And when they sent me to do it, because I was not even having, my case, it was really critical, because I switched from one hospital to the Penn State. My treatment started with UPMC. That's where my cancer was diagnosed. But because the healing was not, they were not satisfied. So they sent me to a Penn State hospital.
I worked at Penn State University.
Really?
2013 going into 2014.
I was already, I'm
You
here.
were already there?
Yeah.
Wow.
I even moved to North Carolina by then. Yeah.
Oh, okay. So you in North Carolina have also lived there. So we are so much of sisters, Did they diagnose you with the cervical cancer at Penn State then? With the cervical cancer?
Yes. So Penn State. So now they have to make sure I have all these doctors in their hospital.
Yes.
So to have a gynecologist and all this. So the primary doctor want me to do because with my kidney, I kept on having this infection coming constantly. So when they did the swab, and they told me to go home. Yes. So this was my first time, actually. I do not know. I do swab, but it's just for infections. It was not, that into detail about HPVs and stuff like that. Mm-hmm. So I remember when I went home, I received a call.
Yes.
It was on a Thursday, and I received a call for an appointment for Tuesday. Mm-hmm. So they told me that they find me a gynecologist in Penn State that they want me to see. Mm-hmm. I said, okay. So when I went back to meet that gynecologist, he's a guy, he's from Nigeria. Yes. So when I meet the guy, and he was like, okay, they checked, but there is something called HPV. Mm-hmm. So people have it. Mm-hmm. But in females, it's not like it's bad. But some people, especially people that have breast cancer, most of the time, they usually have cervical cancer. And for you are part of those women. They are usually on high risk. We give them vaccines and stuff, but for you, you already have it.
The HPV.
Mine was positive and it was cancer already.
Oh, okay. So they found you to have HPV.
Yes, positive.
They also found you to have cervical cancer.
Yes,
All right. But they were telling you that this is common amongst women who have had breast cancer.
breast cancer. Yes.
But did they tell you at that point, and then right now we're just interacting in terms of information that's out there, did they tell you that HPV mostly is spread through unfaithful spouses or partners? It's a sexually transmitted.
Yes. So they told me that they even asked me.
Yeah.
They even asked me. I'm circumcised.
Yes. Okay.
So they
You see,
have to.
we
Yes.
need to talk about that again. I've never known. Okay, so our next session is going to be female circumcision. Yes. Hey, topic. Okay, let's continue. And everybody who is agreeing with me, say yes down here. So we see. We have to know. Do you know I went to school around an area in Kenya, the Kuria. I went my primary school. I was in a Catholic boarding school in the border of Kenya and Tanzania, and the Kuria tribe, ethnic group there, they used to circumcise their females.
Yes.
Yeah.
Yes.
About that. Yes. So tell me now. So you are circumcised. So what were they telling you around that time because of that?
So now the infection part. They want to get more information to this. They don't just wanna connect this to the breast cancer alone.
Yes. Yes.
They want to rule out.
Yeah.
So for me, it was not just being diagnosed with breast cancer, but they wanted to know what kind of infection did I have through this journey.
Yes. Yes.
And when I was circumcised, what kind of how do you call it?
Tools.
Right. Yes, they were using did those things leaves any infections that was developing to this stage.
Yeah. Yeah.
Anytime I am talking to my people, I speak to them in my language. I tell them a lot of these infections, it doesn't happen today.
Yeah.
It happened years back.
Yes. Yes.
So it develops.
Yes. And now you brought a very important point because now I see because it's sexually transmitted. It also goes to the tools. Were they sharing?
Yes.
How is the circumcision done? Is it the way the courier were doing that time where people line up?
You see my face? You see this?
Yes.
You see? So
Yes.
this is part of what they do. So they will use the same razor blade to cut this.
Yeah.
Or whether a knife. I don't know. I cannot
They use that up here and they use that down here and they use and repeat it on different people.
exactly.
Now I get it.
But because I do not witness it, I don't know. I cannot explain. And the worst part was, I remembered, so they let the blood clot in you. Because they don't want you to just voluntarily giving yourself to a man. You understand? So when you get married,
How does that make
so
you
you
know?
know how they cut you and you have to bleed. So they don't let that bleeding come out. They make sure they don't clean you. Yeah. So now, until when you get married, okay, that virginity is so much respected. That when they take you to your husband, and then it's hard to penetrate you, they will bring again one older woman who will come again and record you. So, so, so these are processes that harm me more than I expected.
Yes. Yes, it did. Yes,
You understand my point now?
yes. I believe that. And what age were you at that time?
Uh, I know I was a teenager.
Yes, you're a teenager. And that's why now they talk about, please, can we give the HPV vaccine to our
Yes.
teenagers, especially the girls, because the girls, they will get it from the men if they start becoming sexually active. Because the men are just the carriers. They just go in there and drop. And then now they come to circumcision and this woman has it here. And then they take the same knife, whatever, they use it on another woman. So they're also helping they're spreading it like the men. They're carrying it from here and taking it to this other woman. And so I can imagine how many women that they went within that circumcision. How many young ladies, young women were infected with HPV? I'm so sorry about that.
Yeah. So now I have to recall.
Yeah. And you have to explain all that to the
Yeah,
doctor.
because at that moment they give me 3 months. So they have to give me the deposit, which I never used before. But they have to give me the deposit because they don't want me to see any of the periods again. They don't want me to get any more infections. Now they're trying.
The doctors at Penn State.
Yes. So they have to cut off everything about me.
Oh, so did they do the total hysterectomy at that point?
Yeah. No. Yes. But before they do it, I have to stop seeing period. I cannot see period because I cannot have any more infection down there.
So when they say you cannot see period anymore, I know mostly period comes because the ovum comes from the ovary. So is it that they took out the ovary? So what does this medicine do to stop the period?
So this medicine stopped me from seeing my period because now they're controlling my infection level.
Yeah. So does that medicine go to block the ovaries? Or so
Yes,
that
it blocks the ovaries.
okay.
And then again from my anemia and all that because now they're preparing me for surgery.
Yes. Yes.
They're preparing me.
Yes.
But now they wanted to underline
Yes.
more
Yes.
because I have daughters
Yes.
and one was born in Africa. So now I have to have a file that they need to put in order to go through this.
Yes.
Not only me, but her.
Yes. And did at that point were you already well healed from the breast cancer surgery? No.
Nope, nope. It was back to back. That's what even make it worse. I remember my cervical cancer surgery. You know how you go 3 days, you go home.
Yeah.
You see, I'm even having bumps. But with the cervical cancer, I was there for more than 1 week. I cannot even stand. When I stand, I fall. Because, like, I was being strong, but again, the body was giving up. The soul, the ment, I was trying my best, but the body was giving up. So the worst part was doing this, and then here comes my mouth, all this nutrition, my teeth were falling apart. I'm having all this kind. I don't even know how I looked at that moment of my life, and I have to do that kangaroo care. I don't have a choice with the baby. So it was just painful. And then if I look at these kids and I'm like, I can't do it. Who's gonna do it for me? I can't. So you holding on something that you know with everything. You are like, is it gonna be possible? Can I really do it? Does it even, does it really matters to me? But hey, it does.